So what we're going to do is we're going to talk pre-zest dry eye wheel. So we all understand dry eye is characterized by the loss of homeostasis on the ocular surface. That is how Dews 3 describes what dry eye disease is. And it is a disease, it's not a syndrome, it is a disease, and we should refer to it as a disease. So we all can understand that we lose homeostasis, i.e., we're not producing the quality or the quantity of tears. So homeostasis is lost. By losing that homeostasis, what actually happens is our body's natural response is to flood the ocular surface with something called cytokines. Cytokines are the inflammatory cells that are delivered to the ocular surface, which deliver discomfort, pain, ultimately all the symptoms associated with dry eye disease. Now, once those cytokines are delivered and that discomfort happens, that's what causes inflammation. And without inflammation, we don't have that pain or discomfort or dry eye irritation. So it all reverts back to inflammation. Now, the problem with those cytokines being delivered to the ocular surface, which therefore delivers inflammation, is it restricts everything. There's no space anymore. And when there's no space, our meibomian glands, those amazing glands that produce this oil, this meibum that protects the tear from evaporating, becomes restricted. And by restriction means the fewer quantity or quality of meibum is produced. Now, the problem with that is it increases tear evaporation, which therefore causes homeostasis. The problem with this dry eye or dry eye disease is that it is a repetitive circle that has to be broken. No single drop will be able to break this cycle, and that's the power of zest. And the reason why zest is so crucial is it breaks that cycle. Now, how it breaks the cycle or where it breaks the cycle is as soon as we see a patient with the loss of homeostasis, i.e., dry eye disease, that's when we intervene. That's when zest becomes its own. So we want to break the cycle as soon as we lose homeostasis. And we do that by reducing our cytokine action. So the cytokines are delivered to the ocular surface. What zest will do is it inhibits or restricts the amount of cytokines being delivered to the ocular surface. By reducing or restricting the amount of cytokines being delivered equals less inflammation. So less inflammatory cells equals less inflammation. And just simply by reducing inflammation, we immediately increase patient comfort. We restrict that pain, that discomfort, those symptoms of dry eye disease instantly. But what is more important, and what happens also with the power of zest, is it restricts, or by restricting that inflammation, it allows more space. And by more space, our meibomian glands start to open up. Now, the good thing with increasing the size of those and the space of those meibomian glands is they now produce a higher quality and quantity of meibum, therefore protecting the tear from evaporation, which is now restoring homeostasis. And that's how we break the dry eye cycle. So by simply, as soon as we see it, we intervene with zest, we reduce that inflammation, we reduce that cytokine action being delivered to the ocular surface, which allows one, instant relief to patients, but more importantly, it has that longevity relief. And that's why by improving the quality and the quantity of meibum, that's why zest lasts for so long.